Okay, we're going to talk about cluster 4, AT6, and you saw that AT5 was part 1 and this one is part 2. Okay, and there's 8 questions that we're going to cover and it should not exceed 500 words. So again, if you're going to think about how much time you need to spend in each question, you could divide 8 into 500. Again, some answers might be longer and some may be shorter. Okay. It just needs to average out. So we want you to, so remember in AT5 we looked at stages of the lifespan and we got you to consider what primary health services they may present to. So there was infants, children, adolescents, adults and elderly. And so you may pick one of those lifespans and pick a medical condition commonly treated in primary health care, okay, and conduct further self-directed research, okay. So remembering the word research, so we want you to show us your references and where you've got the information from, okay. So question 1, we want you to describe the condition and we want you to describe the medical condition, including how they present to primary health care and common complications, all right. Number 2, identify the nursing priorities for care for patients presenting with this condition. So in order of priority, so you might list 3 things that they may present with and what are you going to do in which order, okay? List 3 nursing assessments that you would perform for this patient in order of priority, providing a rationale for each. Again, this is going down to your nursing assessment, so your head-to-toe assessment, all right? And what you would do first, second and third, and tell us why, and tell us in each assessment what you're doing and why. Question 4, identify 2 other nursing interventions you would perform. So again, you're thinking about nursing interventions and you could think non-pharmacological, okay? Question 5, identify the potential, so we're breaking this down, this question, so identify the potential physical, psychological and social impacts, all right? So you're addressing, I would put question 5, physical dash and then your answer, psychological dash, then your answer, social dash, then your answer, impacts of the medical condition on their activities of daily living, all right? Question 6, identify actual or potential environmental health issues that may impact the patient. So we're thinking about the environment that they live in, okay, where they live, how far they live, you know, how far they may live from primary healthcare service, you know, what sort of industry is in, you know, the suburb that they live, what sort of industry is in, you know, do they live close to a highway, do they, those sorts of things. Question 7, describe 2 strategies that could be used to address health literacy deficits in primary health care when educating the patient about their medical condition. So your health literacy, so you now in the nursing course have a higher level of health literacy and how you interact with the healthcare system and how it works than what you did before you started the course. When you're thinking about literacy, so that's health literacy. So when you're also thinking about literacy, you're thinking about like, can they read or write, or can they understand? Do they speak a different language? Those sorts of things. Question 8, list 3 ways an enrolled nurse can encourage a patient to engage in illness prevention. Okay, so how can you get 3 ways in which you can get your patient to stop presenting to primary health care? How do you keep them well in the community? How do you keep them away from needing to come and present to primary health care? And that's it for this AT.